Hello, my name is Paul Raymond. I, along with my colleagues Darletta Steinmetz, David Graham, Arthur Boomgard, and Jonathan White, have co-authored a brief yet informative PowerPoint presentation regarding people with disabilities. We are currently working on Masters of Science degrees in nursing. This presentation is made in partnership with the Center for Independent Living of Middle Tennessee. Jonathan White and I will be narrating.
The Center for Independent Living is a community-based, non-residential program. There are 5 CIL locations in Tennessee that cover the entire state. Anyone who has a disability can ask for assistance from this agency. It is managed by board and staff, a majority of whom have disabilities themselves. The center is funded federally, by the state, and through various donations and sponsors.
The CIL mission is to empower persons with disabilities to achieve their own vision of independence and to assist the community to eliminate all barriers to independence.
After reviewing these slides, the listeners should be knowledgeable in the proper language and word choices when communicating with people who have disabilities. The listener will be cognizant of appropriate ways to interact with people who have disabilities. Finally, the listener will become aware of common barriers to those with disabilities and ways in which those barriers can be overcome.
What are disabilities? Disabilities can be a physical impairment such as people with cerebral palsy, spinal cord injuries, multiple sclerosis, amputations, or other physical issues that compromise movement. They can be a developmental delay, such as autism or Down syndrome, and they can also be communication impairments, such as deafness or blindness.
What is the proper language to use when communicating with or about people who have disabilities? Some are unaware of the appropriate language for people with disabilities, while others might utilize derogatory terms instead of acceptable terms. We are going to provide you with the proper and preferred language so that you can be sensitive to the needs of your patients or clients. The best word choice is disability rather than handicap. The word handicap is considered more offensive because it was derived initially from cap in hand, likening the term to a beggar. The more acceptable word choice is disability. Use descriptive terms as adjectives, not nouns, such as the person who is blind or the person who is deaf, rather than the blind or the deaf. Instead of identifying someone as a 50-year-old male wheelchair user, put the emphasis on the 50-year-old male with multiple sclerosis who uses a wheelchair. Avoid a negative description of a person's disability. You would never say the cripple, since this gives a derogatory sound to the physical impairment.
Try to portray the person as who they really are, not as someone who's overly courageous or brave, special or superhuman. Recognize their accomplishments, but keep it in the context of the visit or meeting. We have all been taught that normal is rarely a good descriptor. This is especially true when describing those who do not have disabilities. Most of us have the privilege of hearing and seeing. When we see or hear someone who cannot, it is easy to assume that there are other disabilities as well. This is often not the case. You can never assume communication impairment means that there is a cognitive disability. Just because someone cannot hear or cannot see does not mean they cannot read or write or that they cannot learn.
There are recommended ways of communicating with people who live with all sorts of disabilities. There are also words that are not advisable to say when referring to people with disabilities. You would say a person with a disability, but never the disabled. You would say someone who uses a wheelchair, but never wheelchair bound. Think about it. They may be able to move somewhere other than just the wheelchair. You would say congenital disorder, but never birth defect, as a person is not defective. You would say has polio or cerebral palsy, but never suffers from or a victim of. We have illnesses or impairments, but we live our own lives. We are someone.
People with disabilities have feelings. Everyone is human after all. Some disabilities are not always easily seen. Just because someone looks like they do not have a disability and have parked in disabled parking does not mean that they do not have a disability. You should ask the person if they want to shake hands, as we should all be respectful of personal space. You should always speak directly to the person, even if there is an interpreter present. The person signing via sign language is still your primary source. Do not bring up the disability unless it is relevant. Relax. As humans, we all respond to honest attempts at caring behaviors. It's okay to say, "See you later," even to someone who is vision impaired. Casual conversation is important to everyone, and this is a common phrase. Treat age appropriately. If a person is 40 but has a slight developmental delay, do not treat them like they are a child, but simply make the information easier to understand for their current level of cognition. Always clarify if you need to, and try to be proactive about accommodations such as restrooms or telephones.
There are certain terms that you would absolutely want to avoid saying. Able-bodied, retard, crippled, defect, handicapped, invalid, suffers from, victim, or bound. These are all negative, derogatory terms that are considered extremely offensive. Normal is a term that is also avoided, since if one is not viewed as normal, it is assumed that you are designating them as abnormal. This would again be a negative, derogatory statement.
What should you do if a person has a communication or cognitive impairment? Although these are two separate issues, they do have some fundamental similarities. The primary difference is if someone is blind, you would not need to reduce your language as you would for someone who is cognitively impaired. For someone with cognitive impairment, you would use simple language and instructions. For both, you would stay focused on the person and allow time for them to respond. This is one of those times when you need to spend a few extra minutes listening to the person.
What should you do if a person uses a wheelchair for mobility? We all have personal space, and the wheelchair is part of theirs, so please do not touch it. Put yourself at eye level by sitting or kneeling. This makes everyone more comfortable, and no one is above anyone else. If you know the patient has an impairment, rearrange your office and equipment to accommodate prior to arrival, and offer accessible places such as restrooms. We cannot assume that medical offices and equipment are accessible. Check this out before referring a patient for further care.
If a person is deaf or uses a hearing aid, observe them first, or let them start the communication process. They may use sign language via an interpreter, a writing board, or a computer. Talk directly to the person, not the interpreter. Face them directly, since they may also be reading your lips. Use simple sentences, facial expressions, and body language.
If the person has a speech disability, pay attention, be patient, and wait. They may need some extra time. Ask them to repeat for clarity if you need to, and some may have speech devices. Don't be afraid, but admit that you're unfamiliar, but willing to learn. Just be patient and willing to participate.
If the person is blind or visually impaired, say hello. Introduce yourself and others in the room. Excuse yourself when leaving. Let the person touch your arm and guide them, but never push or pull. Use the numbers on a clock to locate items such as food on a plate. Remember that guide dogs are not pets. they are working, so please do not touch them without permission. Provide alternative methods of communication, such as Braille, for important documents. You could also suggest that they bring a recording device to future appointments so they can replay your conversations and instructions later.
Public access to buildings and healthcare is important to everyone, but especially to those with disabilities. Imagine going to your current doctor's office. What transportation do you take? How do you enter the building? And how do you get examined? Now imagine being a person with a disability. How would your experience be different? A disability access checklist has been devised for a quick survey of public access for entrances, elevators, doorways, transportation, drinking fountains, restrooms, examination rooms, specialty equipment, and staff. Please feel free to copy this list and use it as you need and to discuss options with people in your practice.
Imagine going to the hospital for a doctor's appointment and you use a wheelchair. Now, plan on parking and entering the building. Did you know that entrance to the facility needs a no-step entry for ease of wheelchairs? That there must be designated parking spaces available? For 26 to 40 parking spaces, 5% must be designated. 41 to 100 spaces, there must be 4% designated. 101 to 200, 3% designated. And 201 to 500, 2% designated. All doors need automatic door openers with sensors.
With regard to the elevator, there must be Braille on the panels. You should also ask someone who is blind if they would like you to push the floor number for them, but please wait for them to respond, as they may wish to do it.
Now close your eyes and go towards the closed door. Try to open it with a handle and walk through the door. Did you know that door and doorways need a 32-inch opening with a 90-degree swing? This is so a wheelchair or other assistive device can easily pass through the opening. Thresholds are not to be higher than 3/4 of an inch for easy transitions. 2 hinge doors must be 48 inches and swing together in the same direction. Door handles must be easy to grasp. Automatic doors must open slowly, not faster than 3 seconds, and take no more than 15 pounds to stop the door. We want people with wheelchairs, walkers, and canes to be able to navigate carefully, and the door not open too quickly or close too quickly, or a body part be crushed in the door.
People with disabilities must have access to public transportation stops, such as the bus or cabs. Please suggest referrals, such as Access Ride, the Nashville area MTA system for discounted rides. There are other agencies, such as the Mid-Cumberland Human Resource Agency van service. Please make sure to familiarize yourself with the agencies and resources in your area. People with disabilities must have access to all parking, all areas in the building, and access to sidewalks. Become familiar with the resources that are available in your location.
Did you know that a drinking fountain must have a spout no higher than 36 inches? This is so people who use wheelchairs are able to reach the water.
And did you know that restrooms must have a turning space of 30 by 48 inches, access to a stall of 36 inches, and sinks no higher than 34 inches with knee clearance of 27 inches? The pipes beneath the sinks must be insulated. Imagine being in a wheelchair and washing your hands but burning your knees on a pipe that's not insulated, or not being able to navigate your wheelchair into a stall that is too small.
Did you know that healthcare exam rooms need an adjustable height examination table and space to turn around in? Perhaps 1 to 2 examination rooms could be set aside that are extra spacious for patients who have disabilities.
Did you know that healthcare equipment such as x-ray machines, weight scales, examination, and procedure chairs must be accessible for people with disabilities? Providers' offices must also have transfer equipment.
Now let's talk about office personnel. Does someone know sign language, or is there a hotline for interpretive services on call? Is there ongoing disability awareness training? Are Braille or other communication methods available?
In conclusion, we have enjoyed relaying this information to you regarding people with disabilities. Our hope is that the knowledge you have received will empower you to properly interact with people who have disabilities and to help identify disability access needs, including access to healthcare.